And we're back here courtside. I'm Steve Cashel, so I'm going to be joined by one of the fine doctors from Midwest Orthopaedics at Rush, Dr. Greg Nicholson. Docs, thanks so much for joining us. Dr. Nicholson is a specialist in shoulder and elbow surgery at MOR, Midwest Orthopaedics at Rush, the team physicians for the Chicago Bulls and the Chicago White Sox. So I want to ask you, if you being the specialist in shoulder and elbow injuries, typical shoulder injuries in basketball?
You know, they're not as prevalent as lower extremity injuries, but let's face it, basketball players are long, they're tall, their arms are always out away from their body, and it is a vicious non-contact sport. So there are injuries in the shoulder, a lot of strains and sprains, and most of those things are going to come down to an instability. So we have to identify that injury, and then we have to rehabilitate that injury and then prevent that injury in these basketball athletes.
We don't see elbow injuries as much.
If an elbow injury occurs, it's not like a thrower or a pitcher. It's usually a trauma, diving for a ball and an athlete rolling over that elbow. So those injuries can be fairly severe. It's more of a sprain or just a direct blow to the elbow, and then you get that golf ball on the outside of your elbow, a bursitis. But I think shoulder injuries in that upper extremity athlete, that long athlete, that basketball athlete, are more prevalent than elbow injuries. That's correct.
With me is Dr. Greg Nicholson from Midwest Orthopaedics at Rush, one of our team doctors here with the Chicago Bulls. How about rotator cuff? It seems like such a hot-button topic these days. Doc, everywhere you go, you've got a rotator cuff. And we're talking about the weekend warrior, not as much for the professional athletes maybe. Maybe for the pitchers you see that, but you seeing a lot at Midwest Orthopaedics at Rush these days?
We really do. You know, there's no season that stops with the shoulder, and as we get older, we still want to stay active, and the shoulder has the greatest range of motion any joint in the body, so the rotator cuff's very important. Patients will come in with pain, and many, many times the rotator cuff is involved, even if there's another pathology involved. So, again, we need to identify that injury. So the earlier you see a specialist, you get the proper diagnosis, you can get the right rehabilitation, and then the prevention. Many of these things can be handled non-operatively for sure.
That was my question. Everyone always thinks they need surgery on the rotator cuff, but you can rehabilitate without that?
For sure. I always say, you know, if you've had pain for 3 months and you've done time, activity modification, physical therapy toward that diagnosis or toward that injury, and then it still affects your occupation, your recreation, or your sleep, then you need to start considering a surgical approach if there is one, and that's it within consultation of your specialist as they move through that process with you.
And finally, Dr. Nicholson, talk a little bit about the association between the Bulls and Midwest Orthopaedics at Rush. You guys, fine doctors, some of the best in the country, obviously, and the Bulls are proud to have you, I know, but talk about working with these players.
Well, you know, I think it's been mutually beneficial. It makes us better physicians when we see a high-level athlete like this and try to get them back on the court. And with our experience over the last 10 or 12 years of taking care of professional athletes, I think we identify their unique issues quicker. So it has been a great symbiotic relationship. It's something we value very much.
Thanks so much, Doc, for being with us.
Thanks, Steve.
Appreciate it. Dr. Greg Nicholson from Midwest Orthopaedics at Rush. Appreciate everybody watching us here today on Bulls TV, on the Bulls website, bulls.com. Our pregame show continues. I'll be back with Bill Wennington as we get ready for Bulls basketball tonight. Earlier start than usual, so stay with us on the Bulls Radio Network.